2 decades ago, African Union member states met in Abuja, Nigeria in April 2001 and made a commitment to allocating 15% of their government budgets to the health sector. At the time, more resources were required to address the pressing health challenges of the day, including HIV and AIDS, malaria, and tuberculosis. The Abuja Declaration became a rallying call to mobilize more resources from government coffers for the health sector. With climate change effects on the youth and the COVID-19 pandemic, a number of African countries have had their budgets towards the health sector decreased. Zambia is one such example. In 2013, it had allocated about 11.3% of the national budget towards the health sector, the highest so far, and has, however, been decreasing since. In the 2022 national budget, it has allocated 80% towards the health sector, far from the Abuja commitments, with more health problems and an increased population. In 2001, Zambia had a total population of about 10.4 million people and now is estimated at about 18.8 million people. Medical for Quality Healthcare in Zambia Executive Director Quincy Mwabo says inadequate funding to the health sector has derailed the provision of quality health care to the people.
The budget to the health sector, it hasn't been very impressive. And if you see now, still looking at 2021, 2020, 2019, now 2022, the budget in the health sector is too low. And these are the challenges that we have been having in the health sector. And looking at the population, the population is still growing. At this time, we are above 18 million plus people of Zambia. And we are still stuck to the same budgeting, which is 80%. And that is not fair in the health sector. And we can't expect to improve the quality healthcare services if the budget, the health sector is low.
Dr. Mwabo believes Zambia has adequate researchers and scientists to be leaders in the provision of solutions to the health challenges Southern Africa is facing if government can take the lead in funding.
So we need to invest in research. We have got researchers, we have got scientists. All what government need to do, they need to put more funds in the research. Once we do that, definitely we are going to improve in research as a country. But for the past few years, we haven't done anything when it comes to research.
And the pharmacist Jerome Kanyika says Zambia is still facing numerous health challenges due to inadequate funding from government. He says there is still time, 2023, for Zambia to change the narrative and prioritize the health sector by meeting the Abuja Declaration commitment.
What is needed is for us to start moving towards that declaration. So we hope that in the 2023 budget, we'll start moving towards the Abuja Declaration so that we'll be able to sort out the issues of malnutrition. We will be able to sort out the issues of HIV, the issues of tuberculosis, the issues of even other pandemics, future pandemics that may come in. As you know very well, 2 years ago, we had an epidemic of cholera. Now we have a pandemic of COVID. We hope that with the increase in the funding, if we start increasing the funding to the health, we will be able to fight the future pandemics without the country being stressed or without the treasury starting panicking to look for money from somewhere else and take it to health. That is the purpose of the Abuja Declaration.
With so much to deal with in the health sector in the COVID era, the commitment by governments to the Abuja Declaration must be realized and not be justified that 15% of an elephant cannot be equated to 15% of a chicken. Recently, the Zambian government removed fuel subsidies, with a view of allocating more resources to the education and health sectors. Henry Ngosa reporting for Prime TV News in Kabwe, Central Province.